Good afternoon, everyone. That was very professionally done. Wonderful. Good afternoon, everyone, and welcome to the November Future Health Research and Innovation FIRE Fund Open Day. Let me commence by acknowledging the traditional custodians of the land on which we meet, the Whadjuk people of the Noongar Nation, and pay my respects to elders past and present. I'm Shirley Bowen, the Director General of WA Health, and it is my pleasure to be here with you today. I have a co-MC, Mr. John van der Wielen, our recently reappointed Fiery Chair, and I will introduce him properly shortly. But of course, let's acknowledge our very special Minister, Stephen Dawson. I say our Minister for Medical Research, but also Minister for Regional Development, Ports, Science and Innovation, and the Kimberley. So we also have some fiery advisory members here today with us as well. Kane Blackman, Dr. Marcus Tan, and Jennifer Lawrence. Thank you for being with us. And most importantly, I welcome all of you today to enjoy this fiery day with us as we talk about medical research, innovation, and our special new strategy for the Fiery Fund. But before we actually start, we have the great pleasure of having with us Auntie Frida Ogilvie, and who is a very esteemed elder from the Whadjuk Balladong community, and she will deliver to us a welcome to country. Thank you, Auntie Frida.
Thank you for the invitation to come and join you. And you just never know who I run into at these occasions. And having worked in education for some 40 odd years, and I loved every day of it, I'd go back again if I could, except I'm too old. And one of the things that I am interested in, and that's the rheumatic fever study. I had rheumatic fever as a child. And spent something like 12 months away from home. So I went from Beverley Hospital to Pingelly Hospital. From Pingelly Hospital, they put me in the ambulance to Princess Margaret Hospital, and I stayed there for 3 months. Then they said, oh, you can go to, what's my facility down there? No, it's gone, in Cottesloe. And anyway, I found out where it is, so I'm going to go and visit. And then I went to foster care for 6 months. So all up, I was away from home for over 12 months. So when Dad came to pick me up, he didn't bring me a jumper, did he? So I had to go and buy the newspaper and wrap me in newspaper and take me home on the train back to Brookton. But that never stopped me, because I've got a scar on my left leg, probably about 6 inches long, where they had to take part of the bone out, that little bone, and they said, oh, you won't be able to run or jump or play. Tell that to somebody else, because I ran and I jumped and I swam and I played netball and I played softball until I was 58, and then I decided to retire. But there's some things that will hold us back. Some things just won't hold us back. So having worked in schools, I'm still in touch with schools. Mosman Park Primary School, where my great-grannies go, or out there to Armidale, and doing lots of different things. So my current new role is elder and the senior leader with the school psych services. And so it should be interesting to see what I do. And all the time that I was in teaching, yes, I was in the classroom, but I was always doing other things. So I was with school psychs, I was with curriculum teams, I was with First Steps, I was with the nurses, and I had a little boy who had encephalitis, and he was in a wheelchair and no control over the motor skills and the head and things. And I said, no worries, he'll love it in here. So I used to go down to stand next to him, put my hand over his so he could move this pencil back and forwards. That was his work. And I'm sure there are lots of other stories I could tell, but I won't. So kaya kunaming. Hello and welcome. Nich Kulin, Marit Cardigan. They're the words of Eleanor Roosevelt, who's my favourite author, and I needed a platform to stand on after the referendum and things, and I thought, that's it, that's what I need. I can translate that into Noongar, which is what I did. And so Eleanor's words are, with the new day comes new strength and new thoughts. So I hope you will have something new to think about when you go home this evening. So ngan kura nija bordich work kwap, wanjumaman, bordich nija ngan. I pay my respects to my past, present and future leaders or Burdias and strangers on Whadjuk land. Our Cardigan or knowledge and understanding of Noongar Budja or country reflects our deep spiritual and physical connection to country and to places of significance. For each Noongar group, there is a place of significance where we go to celebrate or pay tribute to those who have passed on. Bilia Kart Murakalak Niji Durble, Durble Yerrigan, Ngari, Kart, Merin. As a Whadjuk Balladong custodian and a traditional owner and matriarch, I welcome you to the Great Sea and the great rivers, the Derbil Yerrigan and the Canning River, or Jalgara, which means abundance, where my family and ancestors left their footprints while gathering their food and constructing their maiamais for over 60,000 years. Everything in our vast landscape has meaning and purpose. We speak our own language and have our own law and customs. The law is characterised by a strong spiritual connection to country. This means caring for the natural environment and for places of significance. Our law is practiced from a cultural governance system, following an unspoken yet understood law. I know. Sometimes I don't know and I need to ask somebody, and usually it's my big brother. Sometimes he'll tell me, quite honestly. Other times he'll say, we'll go and find out. That's why I'm asking you. Noongar elders maintain cultural governance and have the responsibility and obligation to share and pass on Cardigan Whadjuk Budja Wirat Nijamurich. Our knowledge and understanding of Noongar reflects deep spiritual and physical connection to land and places of significance. We stand on Burlu, or a place which is significant for the massacres, the celebrations, and a place to communicate for the community. Connection to Budja or land is passed on through our stories, art, song and dance. Noongar people not only survived European colonisation, but we thrived as family groups and sought to assert our rights to our Budja, or our land. For Noongar people, the southwest of Western Australia is Ngala Budja, our country. Noongar people have a cultural responsibility to have a relationship with the Budja, respecting the land, caring for it and protecting through traditional sustainable practices. So that's why we could burn now, because some of that growth or the undergrowth is wet. But we can't do it in December or in January, too hot, too dry. Jinang Mumbukai Kep Wur Nijangan Burung. Look up and down the land to where the river meanders and meets the horizon and the sky. Look at the sun which warms the land and the rain to nourish and encourage growth. As Noongar people, we come to know our connection to country through our murut or our families. This means we can identify our country, the place where we feel at home, where we can move about freely without having to obtain anyone's permission. Noongar law and custom guides the ways in which we define our country and our rights to it. Law influences how we connect with and care for the land. As Noongar people, we have a duty to speak for our country, to acknowledge its value to our communities and to observe law that governs who may or may not speak for country, as well as share with the broader community. So I invite you to walk beside me and share the history, language and culture of the Noongar people. This contribution makes a rich tapestry to move forward in reconciliation and in truth. Can you say Yanka? Yanka? Thank you. You just learned one word in Noongar. And the other word is Burdawan. Burdawan says, I will see you later, because we don't say goodbye, and I think we're a bit like the Irish. So somewhere along the highways and the byways, could even be on the aeroplane, we'll meet again someday. So good luck and thank you.
Well, thank you, Auntie Freda, for that really lovely welcome to country, or sort of said Yunka, but more so for sharing your story about having rheumatic fever as a child. And I think it probably, I hope, gives everyone some insight into the burden of illness that even today rheumatic fever has with children and adults, particularly in Western Australia. So thank you everyone for joining us today on this November Fiery Fund Open Day. We do have some people online, and I'm not sure where the camera is, but hi and welcome. Thank you for being with us. I do have a few quick housekeeping things that I need to do as MC. Bathrooms, I'm told, are just outside the theatrette, and in the unlikely event of an emergency, please follow the Dexus staff to the exits. I think you know how you came in, but there's an exit at the back as well. I'd also like to ask everyone to switch your mobile phones off. We just heard one ring and all of us went, oops, we haven't done that. So please turn your phone down if you can. Today's Open Day is hosted by the Office of Medical Research and Innovation in the Department of Health and marks an important milestone with the official launch of the new Fiery Fund Spotlight program. The Spotlight program is designed to highlight priority health challenges and connect researchers, innovators, community and government to drive lasting health impacts right here in WA. The inaugural Spotlight theme is rheumatic heart disease, a preventable yet devastating condition that continues to disproportionately affect Aboriginal people and communities across WA. By placing RHD, as I'll call it now, in the spotlight, the Fiery Fund seeks to strengthen collaboration, partnerships, research and innovation in a commitment to drive efforts to eliminate this disease and its devastating health impacts. It is really a very big vision, but I do believe we do need to work together to try and reduce the global impact of rheumatic heart disease. I'd like to take a moment to acknowledge the work already happening here in WA in preventing, monitoring and improving care for rheumatic heart disease. This is made possible, absolutely and very importantly, through strong partnerships and Aboriginal leadership. Today's Open Day will showcase how the Fiery Fund is firing up life-changing health breakthroughs for Western Australia. You'll hear about the programs and initiatives under the new Fiery Fund Strategy 2025 to 30, launching today, and upcoming opportunities for researchers, clinicians and innovators in the forward years. We have a great lineup of speakers, including presentations from our Fiery Fund Advisory Council Chair, Mr. John van der Wielen, Fiery Fund Distinguished Fellow, Professor Alex Tersick, Harry Perkins Institute of Medical Research, Professor Dan McCauley from Edith Cowan University, Professor Jonathan Karapetis from the Kids Research Institute, and Mr. Jeff Moffat from WA Country Health Service. So something to look forward to. But now it's my great pleasure to invite the Honourable Minister Stephen Dawson to address us. Thank you, Minister Dawson.
Well, thank you, Shirley, and good afternoon, everybody. I'll start by saying Kaya, Nala Kadich, Wajok Nyunga Murt, Kaya Kadak Nijabuja. Can I too acknowledge from the land of the Wajok people of the Noongar Nation today? Pay my respects to elders past, present, emerging, and thank you, Freda, again for your welcome. Also should acknowledge the Aboriginal people on whose lands that you are watching today as well. Can I acknowledge our Director General, Dr. Shirley Bowen, and thank you for your ongoing support and helping change Western Australia. To John van der Wielen, the new returned Chair of the Future Health Research Innovation Fund Advisory Council. Thank you, John, for coming back. And can I acknowledge Kane and Marcus and Jennifer who are here as well. We're very lucky to have such thing as a Fiery Fund in Western Australia, and it really is a secure source of funding, and it helps advance health and medical research and innovation and commercialisation to ultimately improve the health of Western Australians. It is a uniquely Western Australian initiative, and certainly one that I'm incredibly proud of, and it's important to acknowledge it is nation-leading. Importantly, though, this nation-leading initiative requires strong, independent and visionary leadership. And so it is my great pleasure to welcome back John van der Wielen as the Chair of the Advisory Council. John's leadership was instrumental in establishing the fund as a driving force in its formative years. And I certainly look forward to working with John again as we continue to raise WA's global profile in medical research and innovation. John took over the reins from Rebecca Tompkinson, who's gone on to be our Agent General in London. I'm hoping Rebecca's watching today. And thank you, Rebecca, for your work over the last couple of years. At the last Open Day, I launched what I think is a bold and forward-looking vision for Western Australia's next chapter in health and medical research and innovation, and that is our Fiery Fund Strategy 2025 to 2030. And the strategy guides investments over the next 5 years and really does help us sharpen our focus on areas where WA has a clear edge. As we heard, its flagship initiative is the Spotlight program. And this exciting opportunity will bring together clinicians, researchers, innovators, industry and consumers to co-design solutions that directly benefit WA patients and families. Specifically, it will bring to life the first of our strategic themes, which is to connect and to collaborate. And of course, as Shirley said, today we're officially launching the first Spotlight program, focusing on rheumatic heart disease or RHD. By shining a light on this issue, we aim to empower partnerships and pioneering research, innovation and translation activities to reduce what can be devastating impacts of this preventable condition. And so we will hear a little bit more from that from Shirley later on. But to support our new strategic plan, I'm very pleased to announce a new forward investment plan for the upcoming Fiery funding programs and initiatives that we'll be launching over the next 2 years. And this plan presents a clear view of the programs and initiatives across 25-26 and 26-27 financial years, offering what I hope to the sector clarity over our funding programs and providing you with the ability to plan strategically. And Dr. Stacey Waters from Omri will step us through the programs a little bit later. Some familiar, but others are new, offering an insight into the priorities shaping the coming years. We can also stand up new programs to respond to emerging sector needs, priorities and strategic opportunities. However, you can count on the programs that you can see on the screen to be opening over the next 2 years. Open Days really do provide a valuable opportunity to reflect on previous Fiery Fund program outcomes and success stories. Since its inception, the Fiery Fund has now awarded approximately $282 million to over 810 different projects over the last few years. It has helped strengthen our research capabilities, it's helping expand our infrastructure, and it is supporting the next generation of innovators and researchers here in WA. We've seen investment in supporting career development of early, mid-career and experienced researchers through a range of fellowships. And of course, we funded early stage innovation ideas that are now taking on the world. Our new strategy and suite of Fiery Fund programs and initiatives announced today will help build on these previous successes and drive research, innovation and commercialisation even further. These new programs are backed by about $292 million available to the fund over the next 4 years. And in fact, with the interest, I'm confident it'll be over $300 million. And so it will bring these and other programs to life, which I'm really looking forward to. I don't think there's a better time to be a researcher or an innovator in Western Australia. This increased investment, but also the new strategic plan, are not only an investment in research and in innovation, but they, of course, are an investment into the health and the well-being of all Western Australians. This represents a commitment to advancing knowledge, to driving innovation, and to translating discoveries into real-world health improvements that touch lives across our communities. So I really look forward to continuing to work with our partners and stakeholders to build a future where research and innovation thrive, and where we can all benefit from a research and innovation informed healthcare system. It's been a busy week, lots of familiar faces in the room. I think I've seen many of you more times this week than I've seen my own family. 3 days in a row for us too. But can I thank you for making the time to come out? This is a valuable opportunity. I acknowledge Dr. Jonathan Karapetis, Professor Jonathan Karapetis, who the Kids Research Institute is celebrating their 35th anniversary this evening, and so thank you for making time in what is a busy schedule for you to be here this afternoon to share with us. But enjoy, really appreciate it, and listen out to some good things to be said today. Thanks very much.
Right. Well, thank you, Minister Dawson. I think everyone's all ready to go now on all our presentations. So just to reflect briefly again on our investment plan, we'll call it that, for the Fiery Fund strategy. The release of the 2-year forward investment plan is an important step in providing the research and innovation sector with greater certainty around upcoming programs. We'll continue to explore new opportunities where funding and need align, but stakeholders can now count on these programs opening over the next 2 years. I'd now like to invite Mr. John van der Wielen, recently reappointed Chair of the Fiery Fund Advisory Council, to introduce himself and his vision for the next phase of the Fiery Fund. For those who don't already know John, he is returning to the role, as we've said, as the inaugural chair he was from 2020 to 2024. John has more than 30 years of leadership experience in the financial services and health sectors and was instrumental in making the Fiery Fund the great success that it is today. We're delighted to have John back in the role as we embark on yet another important chapter. Please welcome John.
Great, thank you and welcome, and thanks for having me back. Minister, people asked me, why did I take the role back on? Was it because I did a good job or that no one else wanted it? And I think the Minister said 50-50. But it was that when he called me, he had the radio playing in the background to take that, and he said, I want you back for good. And when it won my heart, and I'm back. So, but I am genuinely pleased to be back in the chair, because I've often been asked, and you reflect, you get a little bit older, what's your career been, what have you been focused on? And one of the things, if I could have my career again, I would have devoted more time to the health and well-being of human beings. And that started probably when I was CEO of HBF, and I saw the outcomes of what good research, good health systems can do. And I've become far more passionate about it at the end of my career. And nothing more so than saying, when I look at what the Future Health Research Innovation Fund and this government can do, in particularly is I have to highlight that I'm a chair of the company called OrthoCell, which is listed. But the reason I highlight that is I actually get to see in that company the result of a small grant from the WA government about 13 years ago. And then we've also invested into a company called Marine Biomedical, which makes bone from pearl shell in Broome. And those two companies now are employing over 100 people. We've now got homes for great scientists to go into, and I would expect we'll have more than a couple of hundred people employed across 9 or 10 different international markets. It's not to highlight that company, it's to highlight that actually those research ideas came out of University of Western Australia, and they were both born from small grants here in Western Australia. And more importantly than the investment markets, they're both companies that will actually make life-changing developments for people in terms of the returning function to paralysed limb, cancer victims in terms of bone reconstitution and things like that. So it is the important part of being really, really patient. And the one thing that I'm really pleased to see after the sort of 5 years of the Future Health Research Fund is that what I've learnt about OrthoCell, that's now 13 or 14 years, is you have to start today and then focus on companies, and most of them take over a decade. And that's the most difficult challenge we face, is it feels like when you're investing today, how quick will the progress be? Well, I'm looking at Jonathan, with all the research from the Kids Institute and so on. So it is, you've got to start today, you've got to take action today, you've got to be patient and really systematic in the way you approach these things. And if you do so, you'll get really, really good results. But the most recent strategy that has been developed, I'm really confident that the delivery, because of narrowing its focus, will have a better outcome. And that's a tough thing in Western Australia. The first thing I learnt as the inaugural chair was I probably, as a team, we disappointed more people than excited them, because there is always more research to be done than what you can possibly fund. But I'm really confident in this strategy that by addressing the factor that will narrow the focus, we'll have specific spotlights. But to give you an idea, we'll spend around $300 million is forecast to support the new health and medical strategy and innovation activities over the next 4 years. I think if we can continue with that money to make the right decisions with the right people involved from the right companies, we will continue to improve the health of Western Australians and also go on to develop some really good quality companies. And we shouldn't forget about those companies like a CSL in Australia. If you read and understand the research of that company, it started as a very small scientific base to be Australia's largest scientific company. So over the next 5 years, our advisory council, we really will continue to work closely with the Office of Medical Research and Innovation, the expert committees, which are critical to making the right judgments on what should be the future of the research and investment. And I look forward to working closely with everyone and all of the partnerships across Western Australia. And finally, we do have a fantastic opportunity in the change we made to the fund that we can take co-investments. And I think the community and large industry are more prepared than ever to invest in medical research and health if we've got the right way that we manage it and we allocate the funds in the right manner. So I look forward to helping the fund, helping the government, and helping those large areas of business further invest into medical research. So I significantly, I sincerely take on the role. I thank everyone again for having me back. And I look forward to making sure that we present over the next period, and each time we do these, some of those results and the outcomes that we'll deliver on. So nothing gives me more pleasure, actually, than a program I was originally involved in, which was the inaugural Distinguished Fellows Program. And the Distinguished Fellows Program seeks to bring world-leading researchers right here to WA. And Professor Alexei Tursky was one of those two recipients in the inaugural Distinguished Fellows Program and is currently the head of Chromatin and Ageing Laboratory at Harry Perkins Institute of Medical Research, as well as Professor at the UWA Medical School. Professor Tursky is a world-leading expert in ageing science and a leading program to advance healthy ageing through tailored therapies and driving fundamental breakthroughs that he is now translating to new biotechnology applications and companies. Please welcome Alexei.
Thank you so much for the invitation, and Firefine for the wonderful, amazing fellowship and opportunity. Really humbled to present my vision here. So how to help people live well and long? The answer to this question could be different for each of us. So how to know the right answer? And I think we have ideas. So I'd like to present an idea of a longitudinal study where we'd like to map trajectory of biological age to unlock secrets of healthy, productive, and purposeful aging, longevity. We call it an impactful longevity. Let's face it, elderly people in Western Australia and worldwide have challenges. The multimorbidity and polypharmacy challenges, too many drugs. Current medicine is reactive to chronic diseases, and those are disease of aging. The one-size-fits-all approach to aging doesn't really have evidence. And importantly, aging is still measured based on chronological age. It's your passport, where the only thing that matters is your biological age. I think what should be done is we need a proactive and preventive approach, like a neuroscience approach to aging. We need metrics of biological age to be linked to functional metrics, and that better be done on a single cell level, personalized regimen for the aging intervention. Similar things as the medical intervention, not one size fits all. And finally, we bring all the shareholders to the table. That means all of us. So what we propose is a multi-center solution where many institutes and universities in Western Australia will join the efforts. I particularly want to mention that we draw on the strengths of Western Australia aging cohort, the Basildon, RAIN, the Origin Studies, to apply the cutting-edge molecular imaging technique like whole body MRI, wearable devices, continue with epigenetic and gene profiling, connect all this to the functional tests, the cognitive, physical tests, and integrate health records, medication, diets, lifestyle, socioeconomic, and environmental factors to really come up with personalized features of impactful longevity, that healthy, productive, and purposeful longevity. And that will result in efficient healthcare, which is more cost effective, and healthy, productive lives. Do you have rationale for that? Well, we do. Many studies, including UK Biobank recently, suggest that large cohorts, we're talking about thousands of people, will really reveal groups with similar response to interventions. And that would enable the newcomers here learn from those groups and receive personalized recommendations. Further, the study from my group and others suggests that those comprehensive data sets that just mentioned, quite expensive, could be mapped on a wearable output and imaging modalities, which are much more cost effective. And that means that intervention and data and knowledge could be scaled from thousands to millions. So this is not just an observational study, because very deep molecular and phenotypic profiling will help and inform the cohort selection for the future intervention studies. So finally, a unique Western Australia-based comprehensive study with a growing partnership that will involve expanding biobanks, blood and other samples, accessible data sets, hopefully housed at the POSI supercomputer centers. A cutting-edge analysis will talk a lot of experts about hyperbolic space, information distance, and quantum computing. It's also happening in UWA. Scientific Advisory Board would talk a lot of experts, aging experts in Australia and across the world, and we hear a lot of enthusiasm and a lot of support. So we're confident that impactful longevity outcomes will reduce healthcare costs, increase health span, and more importantly, unlock the full potential of human lives in Western Australia, across Australia, and hopefully worldwide. Thank you.
Thanks, Alexi. It's always great to see the types of programs the fund's involved in, so thanks very much. As I get a bit older, I'm quite interested in that one as well, so I'll volunteer. So we'll now turn our focus towards the Spotlight program, and I think already highlighted today when we heard about rheumatic disease in our Aboriginal community in particular, is a focus. And I want to welcome Professor Dan McCauley as an Australian academic and health professional, currently serving as the Dean of the Kurungal Catagen and Director of Aboriginal Research at Edith Cowan University. Professor McCauley has considerable experience in Aboriginal health research, policy and practice, with a particular focus on maternal, infant and child health, as well as primary health care and health services research. So please welcome Professor McCauley.
Thank you, Kaya. Good afternoon, everyone. I'd like to start by acknowledging our elders, past, present, Aboriginal Torres Strait Islander people in the room, and the traditional custodians of this amazing Whadjuk Noongar Budja that was never ceded. And thank you, Auntie, for welcoming us. I'm Dan McCauley. I'm the Dean of Kurungal Catagen and the Director of Aboriginal Research at ECU. I'm a nurse who retrained in epidemiology, and I work in the area of health services research, where we aim to improve how systems can better deliver care to Aboriginal and Torres Strait Islander children and their families. I've got a whole other presentation about how difficult but fun that is. It's a privilege to be invited to speak at the launch of the first Spotlight, a program that brings real attention, energy to solving complex health issues through evidence, collaboration and innovation. And I think it is fitting that the first Spotlight focus is rheumatic heart disease, a disease that tells the story about inequality, community resilience, and the power of research to drive change. My connection with this work goes back to being involved in the End RHD CRE with Jonathan and the amazing team at The Kids, which developed the RHD Endgame strategy. The strategy sets out a blueprint to eliminate RHD in Australia by 2031. But what made Endgame different, what makes it different, is that it is built with Aboriginal and Torres Strait Islander people. It brings together Aboriginal leaders, researchers, clinicians, communities to develop a plan grounded in culture, evidence, and lived experience. The strategy focused on a number of key areas to achieve the elimination of RHD, and these prioritise things like structural and system changes, focus on the environmental, social, and economic determinants to reduce the spread of strep A and the transmission of that infection. A really important focus on primary prevention to improve the assessment and treatment of those infections, secondary prevention to improve the way that we prevent and manage acute rheumatic fever and RHD, and tertiary care to assist those that are living with RHD and to assist those to live their life to the fullest. The strategy takes a multi-determinant approach, one that recognises overcrowding, poverty, and more importantly, acknowledges the role that racism plays in this terrible disease. Over the past 30 years, we have seen incredible momentum in Aboriginal-led research and service delivery, from clinicians leading community health screenings to partnerships, improving housing conditions, and young people stepping up as peer leaders in health campaigns. These initiatives demonstrate the power and impact of Aboriginal leadership in driving change. But challenges remain, particularly in research practices, funding continuity, workforce stability, and embedding Aboriginal governance into the mainstream systems that we're working within. You could say that there isn't a knowledge gap anymore, but there's a gap in the way things are implemented, the way things are led, and the way things are held accountable. We know research plays a critical role in supporting this work, generating the evidence to strengthen policies, programs, and practices. Health services, community, and government agencies rely on such research to better understand challenges, inform decision-making, identify effective solutions, trial new solutions, and validate those new models of care and solutions that truly meet the needs of the community that we're here for. Despite this, there continues to be many gaps and concerns with how Aboriginal research is being designed, conducted, and how findings are applied. The researching on Noongar Boodja consultation report that we conducted in 2022 set out community expectations for culturally safe, respectful research with Noongar people and communities. It emphasised the importance of co-design, local leadership, recognition of Noongar knowledge systems, clear community benefit, and appropriate governance arrangements for those research projects. The findings and principles outlined in the report have informed broader conversations about what genuine partnership and research look like. They reinforce the need for systemic change, shifting from consultation to collaboration and from participation to shared authority. Building on this momentum, national and state level frameworks are now working to embed really strong and important Aboriginal governance and community priorities at every stage of the research process. I've recently had the privilege to sit as a member of the Aboriginal Health Expert Committee in developing up the new Aboriginal Health Research Assessment Principles. These principles will move us beyond compliance, but towards research that is co-created, co-designed, co-implemented, and co-assessed. Research that is culturally governed and delivers direct benefits back to community. We are asking for an assessment not just on scientific merit, but on cultural merit, where the Aboriginal research governance involvement is embedded throughout the research process. In a sense, Spotlight reflects the same philosophy: evidence meeting community wisdom, science working in partnership with culture. The Spotlight program gives us a rare platform, 5 years of dedicated focus and collaboration on one challenge at a time. By choosing RHD first, WA is saying clearly Aboriginal health is everyone's business. And we can do this genuinely this time through partnership, translation, and genuine community and accountability by all. Spotlight gives us a way to connect these dots, linking what we learned from Endgame to new models of care, prevention, programs, and community-driven innovation. As a researcher, I see this moment as a turning point, moving from strategy to sustained action. And by ensuring Aboriginal leadership remains central and our actions are informed by community priorities and robust evidence, rheumatic heart disease can become a condition largely confined to history rather than a persistent cause of morbidity and mortality. So thank you, and I'll say Buddha One.
Thanks very much, Dan, for sharing that information. And there's nothing more powerful than having an Aboriginal researcher working with Aboriginal people for the outcomes that we hope, I'm sure, you'll achieve with this RHD spotlight. I've been asked not to say this, but the Director General of Health has left her mobile phone on the podium. And don't panic, it's Premier Cook's rung 7 times, but I'll bring it back to you in a minute. So thank you again, Dan, for that presentation. I'd next like to invite to the podium someone who I know very well, Professor Jonathan Karapetis, as the Executive Director of the Kids Research Institution in Australia. Most of you probably know this, but Jonathan's a paediatric and infectious diseases and public health physician who has been Executive Director of the Kids for the past 13 years. He's an active researcher and has particular expertise in strep A and rheumatic heart disease. Please welcome Professor Jonathan Karapetis.
Thanks for that lovely welcome. I also acknowledge that this is Whadjuk Noongar Boodja, and I pay respects to elders past and present, and really acknowledge the traditional custodians of all lands in Western Australia who have been so critical to us working in partnership to try and tackle this dread disease, rheumatic heart disease. Minister, John, Shirley, congratulations to you on what you've been doing, particularly with the Future Health Research Innovation Fund. I'm obviously very excited about the Spotlight program, and Dan, couldn't agree more. I think this is the opportunity for a catalyst for us to be able to do something in Western Australia that I genuinely believe could not be done anywhere else in the world, to make significant progress against this disease over the next 5 to 10 years. I think we can do that here because there's so many elements to it. I've got 7 minutes. I think I've used 2 of them already, and I was asked to speak today about strep A vaccine development. And I think it's just a bit of a taster, I suspect, for what sort of things could come out of this Spotlight program. So just really want to give you a sense that this is only a small part of the puzzle, but it's obviously an incredibly important one. And Western Australia really is at the forefront of this field. It's also important that I point out that it's, yes, obviously our focus is rheumatic fever, rheumatic heart disease, but keep in mind that this bug is a nasty bug for a whole lot of other reasons as well. Rheumatic heart disease is the #1 cause of death, but there are a whole lot of other issues that it causes. And indeed, if you do the calculations, it is the 5th most lethal bug on the planet. These are data from 2019. It was #4 then. Obviously, another bug came along in 2020 and changed the situation a bit, but it's still right up there in terms of being a nasty, nasty bug. And there's a whole lot of reasons to say it's the most neglected of all of those pathogens. Yet focuses like the Fiery Fund allow us to really give it the prioritisation it deserves. Why do we need a vaccine? Well, there are a whole lot of reasons, and there's also a whole lot of reasons why we don't have a vaccine. There have been over 100 years of research to try and develop a strep A vaccine, but there have been multiple barriers. There are technical issues. Can we do it? Will it be safe? Do we have compelling enough disease burden data for people to want to prioritise it and actually use it? Are there commercial drivers? Because most vaccines are developed by industry knowing that there will be a commercial endpoint, and that seems to have not been a sufficient driver to date. There's a whole lot of reasons why these are what we call impeded vaccines. In other words, traditional market-driven economics have not been enough to drive them. And so over the last few years, the international field, researchers, public health people and others have realised that we need to do something about that doesn't rely on just industry taking the lead. We need to de-risk early stage development. with public investment, with philanthropic investment, to essentially make it much more attractive for industry to come on board. And that led to the ASAVI program, the Australian Strep A Vaccine Initiative, which is a partnership between the Kids Research Institute here in Perth and the Murdoch Children's Research Institute over in Melbourne. The ASAVI is essentially a partnership designed to accelerate a Strep A vaccine candidate into a clinical trial to demonstrate that we can give a Strep A vaccine safely and effectively to prevent this disease, with a view to then progressing it through to a vaccine for rheumatic fever. We have a fantastic setup. We had catalytic funding from the Australian government, the Medical Research Future Fund. We've supplemented that with some additional philanthropic funding. Obviously, this is not enough to get us a Strep A vaccine, but it's a really good start. And what we've done is really tried to use this funding to reduce the risk of early stage clinical development. So where are we with Strep A vaccine? So this is the pipeline of different vaccines. Now, any of you who know vaccine development know that it's pretty thin. Normally, for a vaccine for a big problem like this, you'd have a whole lot more candidates in the pipeline. But the exciting thing is we do have a number of these candidates that are progressing and have been progressing in recent years. What you'll see is the phase 1 is when we first give it to people. So not a lot of these vaccines have actually made it into people. But there's been one that's gone through to, the 30-valent one that's gone through to the end of phase 1. That's a vaccine that's no longer in active development for a number of reasons. There's one in the University of Queensland, the Griffith University University in Queensland, that is into phase 1. Others are getting very close. But what's very exciting is that one that's the first of the orange ones, the GSK one. For the first time, we've had a new clinical trial in Australia of a Strep A vaccine. ASAVI's been working very closely with this group, and so in July they enrolled their first patients in Australia, with the view that we are trying to set up the situation in Perth that we can bring the subsequent trials here to Perth. And so we believe that we can undertake these clinical trials here in Western Australia and probably in Melbourne and possibly in Adelaide to get that proof of concept that the vaccine can work. We also have developed here in Western Australia the assays, the biological assays, immunological assays that you use to see whether or not a vaccine's working. That's now an accredited laboratory here at the Kids Research Institute. And we've undertaken a very extensive consultation with Indigenous communities who, for the first time ever in this country, have expressed an interest in being involved in the vaccine trials because they really recognise that this is such an issue for Indigenous communities. And that will be an ongoing focus of our work. So our achievements to date, we do have that first trial started in Australia in July this year. We have established the baseline for clinical trials in Adelaide, Perth and Melbourne. We have the laboratory assays, we have a First Nations program. We are, without doubt, the place that the world is looking to. And I don't just mean Australia, I mean Western Australia is the place the world is looking to progress Strep A vaccines. And we have new vaccine developers who are approaching us, wanting to bring clinical trials here to Western Australia. So we now see that the investments we've made in ASAVI, but also the focus on rheumatic heart disease here in Western Australia, has Australia now seen as the international leading site for clinical development of Strep A vaccines, and WA has the opportunity to be right at the forefront of that. We will see new vaccine candidates coming over. I'm confident that in the next 3 years, we will have 3 or 4 new Strep A vaccines in trials here in Australia, hopefully every one of them in Western Australia. And most importantly, as Dan said, First Nations communities are at the forefront of this and have the opportunity to be leading that. So I do feel like this is really exciting. There's a whole lot of other things we need to do to deliver on the promise of the Spotlight, but vaccines, without a doubt, are going to be an important part of the puzzle. And I do want to highlight at the end that we have an amazing number of people working at the Kids Research Institute who are working on all different parts of that puzzle. I should have put up there a whole lot of others because this is an amazing place, Western Australia, both for the research, but also that connection with community, with service providers, whether they're government, whether they're community controlled. So the possibilities of this Spotlight, I think, are magnificent. Thank you very much for asking me.
Thanks very much, Jonathan. I mean, imagine for 5 seconds that we do actually develop that vaccine in this state and country would be absolutely amazing. Point of note for everyone, Director General of Health has no sense of humour. And she said to me, John, do you have any embarrassing entries on my health record? I said, no, and she said, you do now. I'm helpful. I just want to help the rest of the people here. Can I keep going with our agenda? Enough jokes. Can I please welcome to the podium Jeffrey Moffat. Jeff is the Chief Executive of the WA Country Health Service. He began his healthcare career as a physiotherapist, working in WA's Kimberley region and Kununurra Hospital. Thank you, Jeff.
Thank you, John. And thanks to Auntie Freda for that wonderful welcome. Thank you. And very apt today. The fact that you shared with us that you had acute rheumatic fever is incredibly relevant, and it's actually much more prominent than probably most of us know. Can I also acknowledge Dr. Shirley Bowen, our Minister, and John, and the fund itself. I think we can see that it's clearly starting to have significant impact, and it's generated a lot of energy today, I guess, in terms of the Spotlight program. I'd just like to acknowledge all of our traditional owners right around WA, particularly the Whadjuk Noongar people here in Perth. Just in terms of impact, you can see this is just an example. WA Country Health Service manages the register on behalf of the department and in Western Australia. 87% of the people are Aboriginal, so disproportionate and significant impact. 95% of ARF in the last 5 years occurred in Aboriginal people, mostly children 5 to 14 years, and the impact clearly is lifelong. 1,900 people currently, and that no doubt is understated. As the more screening that occurs, the more that obviously is discovered. But 1,900 WA people live with ARF and RHD impact. 880 people, many very young ones, requiring monthly penicillin injections. And at a tertiary level, 26 surgeries, heart surgeries in 24-25 alone. And you can see the distribution there, remoteness, environment, poverty, all those factors that Dan and Jonathan and others have talked about, really significant impact. So this is really a disease that's profoundly challenging, I think, particularly for our young ones and for our Aboriginal communities. The challenge, I guess, at the moment, we're a health provider, and the state health system gets very focused on hospital services, public health, emergency departments and surgery. We obviously need to continue to work really strongly to improve care and improve outcomes, and there's significant work going on that front. But clearly, getting to community in the partnerships that have been alluded to today to improve the environmental conditions is absolutely critical to making long-term change. And I guess the promise of a vaccine, Jonathan, would be extraordinary. So let's hope we get there sooner rather than later. I won't talk too much about the end game. I think Dan covered most of this, but a really well-developed, deep, rich strategy, multiple layers to it. We ourselves obviously drawing upon that, but I really do want to acknowledge the NACCHO and the community controlled sector and what they are doing currently through their investment from the Commonwealth to have a significant impact on the ground. A couple of examples of those where we partner with multiple agencies, including the community controlled sector research institutes, is the See, Treat and Prevent trial. You can see in 9 communities, we've had 50% reduction, or we've seen 50% reduction in skin sores over 5 years. Very exciting work, but the sort of work that can be impactful through partnering and through really dedicated and focused effort. But it is complex work. Moving on to, I guess, towards the more tertiary end of the spectrum and diagnostic end of the spectrum, training Aboriginal staff. The nearest Echo Scan is a trial right across Northern Australia, actually, and James is the lead investigator here somewhere in the audience, James Marengu. Getting people very involved, Aboriginal people very involved at the front end of diagnosis, access to care, cultural security, and making sure that remotely available technology diagnostics are improved for Aboriginal communities. And this is a really big challenge. I think it's it's excellent to see the sort of outcomes that we're seeing already in terms of the sort of health worker enthusiasm, the leadership and the take-up and the programs. There's just a little example here of a Jigalong, a combined training event, but also the Jigalong RHD screening event. 119 community members, 8% had positive echo screens, 3 new diagnoses, and so on. So significant impact on a single visit to a community. But you can see the complexity of getting all of that done with all of the partners there in the room. And that's why really going back to the new strategy objectives about connecting and collaborating, really accelerating. These are the elements of, I think, obviously the new research and innovation strategy, but importantly for this Spotlight project, no one of us can have a big impact on their own. And finally, the SCIP trials. Some way to go here, I think, in Western Australia, but we're very keen to see more participation and take up. We know, particularly for young children, but for those that need ongoing treatment, there are lots of reasons that is difficult and challenging. So subcutaneous injection trials continue. Finally, just on the ground, innovation meets equity. As I think Dan or Jonathan pointed out, I can't remember exactly who, but there's a lot of knowledge. We don't have a knowledge deficit about what to do broadly around rheumatic fever, rheumatic heart disease, and both prevention right through to treatment. And us getting very effective with the community-controlled sector, with boots on the ground, there's significant spread through agencies to make sure we put priority and focus in action in a truly culturally governed way so that we're accepted by communities, and the community-controlled sector has a very strong role, I think is critical to getting that knowledge onto the ground. It's very frustrating, I think, to see the lack of take-up at times and the availability and the acceptability of secondary prophylaxis at the moment, and also the real challenges that we experience with the register. It's an outdated register. It needs to be modernised, and that's something that we've got in train and hopefully can progress. But I guess moving on those opportunities also requires us in country WA to have more diagnostic capability, like CT angio, in the remote parts of WA, rather than the tyranny of distance and the burden of actually shipping people to Perth with families often, where we know access to care is very limited if you cannot get it locally. So some really good things to invest in. Obviously, scaling the opportunities, the innovations that we've seen so far, we think should be a major focus now. We want to work in country health very closely with the research sector, with community-controlled organisations, as we currently do on all sorts of services, but importantly in partnership to make sure we actually have impact for families on the ground with current knowledge. And then finally, digital innovation, I think is a very big piece of this. We know we've got an EMR coming for the state, but the way in which partners can connect around digital technology is critically important. So that's it from me. Thank you. And again, thank you very much for this opportunity, Minister, Shirley and John. I think it's an excellent focus first up for a small but very impacted part of the community. Thank you.
Thank you, Jeff, for giving us a sort of on-the-ground look at what's happening in WA Health in this regard. And thank you to our speakers. It's really great to just get a little insight into some of the work that's already happening in terms of research, but there is a lot more. And some of the things we haven't talked about today are some of the skin health, primary prevention aspects. There's work being done in secondary prevention and treatment in terms of penicillin, and then we've got the vaccine as well. So lots happening in this space. So I'm the boring one, John's funny one, so I'll just tell you that now. So I'm just going to go on and talk about the actual Spotlight and some of the architecture of how we're going to present the Spotlight to you over the next few years. Officially, of course, it is a launch today, and that's because we're actually investing $25 million over 5 years to drive this sort of transformational change, particularly in this case in rheumatic heart disease. But the actual Spotlight program is intended to address what we'll call a uniquely Western Australian research or a problem that's unique to WA. Now, rheumatic heart disease is clearly a global problem, but it does have a significant burden of illness right here, as we know. The Spotlight program will actually support all the efforts, some of the efforts we've heard today, but all of the efforts in this sector. And it's intended to bring the sector together by enabling us to appoint an activity lead with proven expertise in program leadership, managing partnerships, consumer engagement, and in this instance, particularly in rheumatic heart disease. This activity lead will coordinate the Spotlight program for the whole 5 years. So it's a new way of us actually delivering this investment opportunity. In this Part A of the Spotlight program, we will be looking for this Spotlight lead. It will be an individual or an institution, an individual representing an institution who can articulate the vision for eliminating rheumatic heart disease and who can bring together all the right collaborators and partners and bring them to one table and present the idea as a cohesive and single plan. The lead will be selected through a competitive process, and we will outline how applicants can apply for the opportunity. The successful activity lead will then be provided with $1 million to conduct the sector-wide consultation over a period of 9 months, with the aim of presenting the Fiery Fund and Council with a cohesive plan for eliminating rheumatic heart disease. It is expected that the work plan will be delivered by multiple stakeholders who are best placed to deliver each work stream using subcontracts or other mechanisms to ensure the funding goes to the right people to deliver those areas. We are also looking for the Spotlight lead to describe how they will attract co-funding. And I think this is really important because 25 million is a lot of money, but imagine if it were 50. So we really are looking for those alternative partnerships. Once the action plan has been reviewed and approved by the Council, Part B of the Spotlight program will then release up to 25 million over the next 4 years to implement the agreed activities. We think this is an extraordinary opportunity for the sector, and it brings people together, researchers, health professionals and communities, to build an ambitious and collaborative program that aims not just to reduce, but we'll keep saying it, to eliminate rheumatic heart disease in Western Australia. The full details, as I've mentioned, on eligibility, guidelines and application instructions will be available on the Fiery Fund website. It now gives me great pleasure to introduce Stacey Waters, our Executive Director of the Office of Medical Research and Innovation, who's going to provide an overview now of the next Fiery programs and initiatives, which will be open for applications. Please join me in welcoming Stacey.
Thank you, Shirley. Thanks so much for coming today. It's amazing to see the large number of people in the audience with us today, and to those online, thank you for taking the time and joining us. I'm sure I speak for every single person in this room today to say how inspiring has it been to hear the incredible pieces of work that are happening in Western Australia to really to work toward eliminating RHD. But imagine the power of us coming together as Team WA to truly do this in a coordinated and meaningful way to really achieve impact. That's exactly what we are hoping to do with our new Spotlight program. So it's my great pleasure today to talk to you not only about the Spotlight program, but to actually talk you through the funding programs that we gave you a little sneak peek of earlier. Minister, you might not have seen it behind you, but we did show the sector, show the people in the audience the new funding programs. Our aim, we have our new strategy. It is very focused, it is very deliberate, but our aim remains the same: to support research and innovation and support excellence in Western Australia. But now we're focused. We're really trying to bed down the funding programs that are going to get us to allow us to achieve the vision in our new strategy. So as you saw earlier, there are a new range of funding programs now available through the FHRI Fund. We're very much committed to and ensuring that every program we open is linked to one of the strategic themes of the new strategy, which you can see on the left-hand side. The middle column provides you with the names of the program an initiative that we are now opening, and then you can see a little bit of detail here around the aims and what we're trying to achieve through opening these 7 new programs. These are our standard P&Is, or programs and initiatives, that will be available over the next 2 years for you. However, the Advisory Council have the ability and the flexibility to be able to offer new funding programs and opportunities as the need arises and as we see new opportunities for Western Australia. And these will be bespoke programs, but you can count on these 7 programs opening for you over the next 2 years. These fewer P&Is allow us to be focused, provide their recipients with more time, more funding, and greater capacity and capability to be able to achieve the outcomes that they are looking for. And it's very much been responsive to the feedback from you, our sector. Key to all of this is the opportunity to co-fund, and we've already spoken about it today, but we will be coming and talking with our philanthropic partners, but also other funders across the sector to see how we can magnify the opportunities that we have with our almost 300 million, which is available over the next 4 years. So as a reminder, here is the P&Is that will be opening over the next 2 years. So we're opening the first tranche of programs today on the left-hand side of your screen, which I'll go through in a little bit of detail. But it just gives you a little bit of certainty and predictability as to the different programs that will be opening and when they'll be opening over the next 2 years. This time next year, we'll come back to you with a revised program to show you their forward plan for the next for 2 years from November next year. So I will go through the programs that are opening for you now in our usual format. And the first program that we're opening is our Spotlight program. This year's Spotlight is rheumatic heart disease. A new Spotlight will open every year. So while we are embarking on a 5-year Spotlight, this Spotlight opening this year is rheumatic heart disease. Next year, there'll be a different Spotlight, again, 25 million, up to 25 million, another 5-year program. So we are really leaning into and investing heavily in the Spotlight program to connect and collaborate our sector. So the Spotlight program, as Dr. Bowen has outlined, is our opportunity to bring all of the incredible work together to see if we can work together as Team WA to see if we can eliminate RHD. We're looking for an eminent lead to lead the Spotlight over the 5 years, and the opportunity will be we'll be looking for a lead. Applications will close on the 11th of March this year. Applicants need to describe for us how and why they are the best person to lead and the best organisation to lead the RHD Spotlight, but absolutely to demonstrate to us how they can bring the entire sector together to pull together a plan for the next 5 years. This is not about one grant going to one organisation, it's about one grant going to one organisation who is partnering with the rest of the sector to get the money on the ground to the people who are going to be leading research and innovation activities. The Spotlight lead will have 9 months, once they're selected, to develop a robust action plan based on consultation with the entire sector. We're looking for activities that span research, innovation, and translation. We're looking at activities which are focused on prevention, treatment, diagnosis, vaccines, new models of care. But we're very much looking forward for how can we spend the next 5 years working together to take the knowledge that we have and implement that into real, meaningful and lasting change on the ground. Once the action plan has been approved, the rest of the funding will be dispersed to the activity lead, and it'll be their responsibility to then administer the funding out through the work streams that have been defined and approved in the work plan. The Spotlight lead will have the responsibility to provide a coordinated, targeted, multidisciplinary, joined up and outcomes-focused plan for research, innovation and commercialisation over the next 5 years to eliminate RHD. We will be having a webinar probably late November, early December for those responsible entities who are interested in learning more. It'll be a very targeted webinar so that we can provide you with the information that you need to help you form your application. This is, I think, a once-in-a-lifetime opportunity. We want to make sure that we get the absolute best opportunities and outcomes for the sector as we can. So, although the Spotlight is a huge focus and one that we're really proud of, we are opening other funding programs at the moment, and they're all now available on our website. So the second program I'd like to announce is the Major Research and Innovation Application Support Program. It is a program that you all know very well. It's a program that is focused on trying to provide in-principle funding support for you, our research and innovation community. So when you apply for your nationally competitive grant, you go into that application process with in-principle committed funding from the Future Health Research Innovation Fund. We're sitting at almost a 50% success rate. So when we provide funding in principle support to applicants to their NHMRC and MRFF and other nationally competitive funding programs, almost 50% of those programs are now being funded nationally. So this program is opening again unchanged. It opens and closes based on the external programs opening and closing dates. So please, if you are planning to submit to a nationally competitive funding program, check our website, make sure you get your application in before your funding program closes so that we can assess your application and provide that in-principle funding support. Again, we do provide a list of funding programs that are eligible for the MRIAS program. If you don't find your nationally competitive funding program on the website, there is a mechanism for you to contact us to make sure that we can assess other external funding programs that pop up that we might not have known about to make sure we can provide you with that in-principle funding support. The next program that's opening today is the Innovation Seed Fund. It is a tried and true funding program. It is one of our flagship programs and one that we're really excited to continue. There's been additional funding that's been allocated to the Innovation Seed Fund and a few tweaks based on some good consultation we've had with both our review panels, our expert review panels, but also applicants to the Innovation Seed Fund over time. We have two streams in the Innovation Seed Fund. So stream one provides funding for devices, diagnostics and digital technologies, and stream two provides funding for therapeutics and vaccines. These two funding streams now have additional funding available to them. So stream one, you can now apply for up to $750,000, and stream two, you can apply for funding up to $1.5 million. We have slightly reduced the IML levels. So now IML levels, so innovation maturity level applications sought from IML level 3 to 6. Our focus now is about trying to fund and support early stage innovation to de-risk those ideas, to allow you to progress to other funding sources. Again, we'll be offering this program with an expression of interest opportunity, and then those applications shortlisted will go to full application. This time you'll actually be asked to provide a pitch video and a pitch slide deck. What we're trying to do now with this sector is to say, tell us about your innovation and your commercial potential and a little bit less about the actual technology. The technology is equally important, but what we really want to know and hear from is what is the commercial potential and what are those opportunities. So we're really focusing and changing the way we're asking people to apply so you get the chance to tell us in your own words and with your own story the importance of the commercial potential. So that's the Innovation Seed Fund, those applications for the EOI. It's a short application close on the 22nd of January. Of course, one of our other flagship programs that we are reopening today is the Research Infrastructure Support Program. This funding is provided to our medical research institutes, our universities, our hospitals, and including our private hospitals to help provide funding support for the indirect costs of research. This program remains unchanged. There are two streams available, up to $25 million of funding that is going to go into our institutions to provide the cost of, to help fund the cost of research that is not otherwise funded. Stream one has $17.5 million available to it, and stream two has $7.5 million available. Those applications close on the 24th of February, and again, this is a funding program that is institutional level, so those institutions will be reaching out to make sure you've got the information you need to help you with your application for the RIS program. Once again, we are pleased to open the FHRI Fund Distinguished Fellows Program, and it's wonderful to have Alexi here today. Alexi is a recipient of the very first FHRI Fund Distinguished Fellows Program. We will be making an announcement of a third recipient in the coming weeks, but this is our opportunity to invite more leading experts to Western Australia. So the Distinguished Fellows Program is a really significant program. It's a 5 years worth of funding to bring experts to Western Australia who can come to Western Australia and build their track record. We're looking for mid to really senior career experts. We are now having our application are now open for level C, D and E academic levels, so not just level D and E anymore. We've now included level C academics in the program, and the program will be continuously open. We know that there's a lot of movement in the research and innovation sector at the moment, internationally and nationally, so we want to have this program open continuously so that we can assess applications when they come through. It's a 5-year package. It comes with funding support for the Distinguished Fellow and postdocs and other research staff with them, and we do look for $1.5 million of co-funding with another partner. If you are interested, if you do have a fellow who might like to come to Western Australia and set up camp here for 5 years and progress their career in Western Australia, but you can't find the extra 1.5 million, please come and talk with our team. We can help connect you with philanthropic partners in Western Australia who we know are supportive of this program. So as I said, this program is continuously open. It's open now. If you do have someone you'd like to bring to Western Australia, please jump online and complete the application, and or come and speak with myself or my team. So they are the 5 programs that are opening today, and we're really excited to have those programs opening again. But there are a couple of new programs that are opening next year, which I wanted to give you a little bit of a feel for now, even though they're not currently open. So these new programs are really exciting. So the first one is what we're calling our Golden Ticket. The Golden Ticket is our Innovation Fellowship program. It is replacing a various number of innovation fellowships we've had over the years, but really what we're trying to do now is provide financial support for 2 years, up to $300,000 for innovators to take time. Maybe they're a clinician, maybe they're a researcher, maybe they're in a startup. It'll provide you with salary support as well as research costs, but also it'll give you the opportunity to travel and to attend accelerators or any type of funding, any type of professional development program you can find that's relevant to your innovation journey so that you can go and take part in those activities. We're looking for innovators who are at that very early IML 2 to 4 level, but this program will also, we're really hoping that we'll form a little bit of an innovation cohort, a Golden Ticket cohort. That cohort can work together, learn together, continue their innovation journey together, but they'll also have access to all of the services in the Murray Street Innovation Hub Launchpad, which is opening in the middle of next year. So that when this program opens next year, we'll hopefully have more information to share with you about the Murray Street Launchpad and how the Golden Ticket will work. So if you're an innovator and you want to spend some time, have some dedicated time to spend on your innovation skills and development and innovation journey, the Golden Ticket is the program for you, opening early next year. We're also pleased to open a fellowship program, and this fellowship program has multiple streams within the program. It's very much in response to the feedback we've had consistently and broadly from the sector, that if we're going to provide funding for fellows and time for researchers, that it needs to be long-term fellowships. So we'll be providing annually fellowship program, which is be a 4-year package. It'll cover 80% of your salary and will be and $100,000 in research costs. We'll have specific streams, so we'll have fellowships available for clinicians, for Aboriginal researchers, and for our emerging research cohort. And each of those categories will have 4-year packages, 80% of your salary and 100,000 project costs. So we're really leaning into and investing in our fellows and giving them the runway they need to develop their research ideas. And of course, the Distinguished Fellows program forms part of our fellowship program, and that is currently open at the moment. And then we're working toward opening a new enabling program, which will be similar to programs we've run previously, where we seek to provide funding for large-scale contemporary and cutting-edge enabling infrastructure to really help and support research and innovation infrastructure in Western Australia. The focus of the enabling scheme is to really make sure we enable WA researchers to become nationally competitive by making sure they have the infrastructure they need to do the brilliant work that they do. It will likely include funding for capital and non-capital, physical and non-physical infrastructure. But those programs will be opening early next year, so you need to make sure you come to our next open day in 2026. We're also pleased with one of our co-funding partners to announce that, and this program has been open for a little while, you have another couple of weeks left to apply for this funding program, but it's a collaboration between the FHRI Fund and the Cancer Research Trust. Applications close, as I said, on the 14th of November. We have up to $5 million available for really innovative cancer research grants. So I encourage you, if you haven't seen it already and you work in this space, to make sure you jump online and complete that application. My apologies. So that gives you a nice clear overview of the funding programs that we will be awarding over the next 2 financial years. As I said, we will be offering new funding programs as the need arises and as the opportunity presents itself, but you can count on these programs opening and closing over the next 2 financial years. We also have a lot of work that's happening in our office, and I just want to take a moment to say that we obviously do have a new FHRI fund strategy. We're working really hard on a measurement framework so we can be very clear with you that the activities and the P&Is that we are delivering for you are actually achieving our strategies. So we hope to release that new measurement framework early next year, and we were aiming to have a really comprehensive calendar of events for the FHRI fund and our research and innovation community more broadly. We're also currently really having a good hard look at our processes, and we're conducting a review of our governance framework, of our end-to-end process of the FHRI fund, our guidelines and conditions, and our grant funding agreements. So we will be reaching out to you, our sector, in the near future to get your thoughts and feedback on all of our process so we can make sure that the FHRI fund is contemporary, it's fit for purpose, and it does what it is seeking to do. So that is all I had for you today. I hope those new funding programs are of benefit to you. Of course, our team are here today, so you're always welcome to come and see me afterward or any of my team that are here, or contact us at any point in time if you'd like to discuss the FHRI fund, the funding programs or the opportunities that we have available. So thanks very much.
Thank you, Stacey. That gives me an opportunity to wrap up. I just want to acknowledge the amount of work, Stacey, you and the team do at times. There's a lot more goes into it than what people do realise. I think just in conclusion, there is a note here. It says your last job as MC, Shirley Bowen. Okay. But I would just like to wrap up, and I think just acknowledge as well the Minister in the room. Can I confirm to you that Minister Dawson, I mean this, you aren't a politician, you roll your sleeves up, you get involved, you've been totally committed, and it's fantastic to work with you. And I think, most of the people in the room absolutely know that, how often we see you heavily involved in the program, and it makes a big difference. I think second, just in relativity, I work with a professor out of Harvard that works at Cedars-Sinai, and he was telling me the other day how Harvard's research has been cut, right, by the USA government. And worldwide, research funding is dropping, not increasing. And yet we work in a state that has a fund of nearly $2 billion. It can produce interest revenue into perpetuity to fund a program like this. So often in relative terms, from time to time you miss out, you get disappointed, you complain to the office. On the other hand, I'm talking to people in the States that they're not missing out, right? These universities' fundings are cut by billions. So we work in a great state, great funding. The funding, in fact, has improved over time. I think our effectiveness has improved over time, and certainly what I want to give you the commitment is the council members who are here and others, we want to be accessible. I think as Stacey's explaining, we need the feedback on the governance and the process, and I will give you a bit of feedback is that I would hope over the next few years we simplify the bureaucracy. There's nothing worse than spending too much time applying and then finding out you fail. I'd rather always fail quickly and not have to waste too much time on that process. So if there's anything we can do that speeds up the process, makes it less bureaucratic, then certainly I want to get heavily involved in that. So in conclusion, I want to thank the speakers. Fantastic to have you all here. Amazing topics. Always difficult to give everyone enough time to cover off enough things, but you can see the amazing work that's happening. I look forward to continue working with you. It's amazing the support and the open days, because I think the first one we ran 5 years ago had to get Mum to come to fill a few seats. And she's fiery, by the way. But it's fantastic to have you all here. Great to have people online, and I look forward to the next one again. Thank you.